We're going to talk about how your natural hip shape may affect your balance or the compensations that you have as a result because of balance. So this is your femur, which is your thigh bone. It sits in your hip socket called the acetabulum. It normally sits on a tiny angle like this. It can have variances in different people. Some people have more of an inward angle. Some people have more of an outward angle. That's reflected by somebody who's maybe naturally a little bit more pigeon-toed. That would be inward, or naturally a little bit more duck-footed, which would be a little bit outward. And that can affect your balance. Multi-sport athletes often train themselves to be more stable in that position, but they compensate in ways through their foot, through their back, through their knee. And so we want to make sure that we understand where your natural balance is and how to compensate that correctly. So Jack's going to demonstrate that. He's going to stand on his right leg, just right in this natural position right here. And he's pretty darn stable in this position. So now he's going to take and turn his foot excessively outward and stand excessively outward like that. Now he's trained himself to be balanced, but you can tell it's maybe not quite as stable as the one that's pointed forward. Now you're going to turn your foot excessively inward. Keep your pelvis pointed straight. And that's maybe not as naturally balanced as when your foot is pointed straight. So let's do that last one, foot pointed straight again. And he's less wobbly, his foot's less wobbly and compensating, so that means this is his more natural stance for this leg, but his other leg is a little different. So if he stands on that leg, pointed your foot straight, go ahead and stand on that left leg. He's pretty stable there, but now point your foot outward excessively. And he's trained, but he's clearly not quite as stable, so now he's going to turn his foot inward. And he's actually quite stable here. So we know that the leg on this left side for Jack is naturally turned in a little bit, where this leg on the right side is naturally in a common anatomical position where the femur is lined into the acetabulum like so.